Hello and welcome to Urologist USA Today. I'm Dr. Your Name, here to bring you the latest breakthroughs in prostate cancer treatment for 2025. For many men, hearing the words prostate cancer immediately brings thoughts of surgery, hospital stays, and long recovery times. But medical technology is evolving fast. Today, we're going to explore two cutting-edge, minimally invasive treatments: high-intensity focused ultrasound, or HIFU, and irreversible electroporation, known as IRE, that offer effective cancer control with fewer side effects and faster healing. If you or someone you know faces prostate cancer, it's vital to understand all your options. Let's dive into how these therapies work and who might benefit most. For decades, the standard treatment for localized prostate cancer has been radical prostatectomy, a surgical procedure that removes the entire prostate gland. This can be performed via open surgery or robot-assisted techniques. While surgery is often effective at eliminating cancer, it carries risks such as urinary incontinence and erectile dysfunction due to nerve damage. Because the prostate surrounds critical nerves and muscles, complete removal can affect important functions like bladder control and sexual health. Recovery typically takes weeks to months, and many patients experience side effects that impact their quality of life. This has led to growing interest in focal therapies, treatments designed to target just the cancerous part of the prostate, preserving as much healthy tissue as possible. High-intensity focused ultrasound, or HIFU, is a revolutionary, non-invasive treatment that uses focused sound waves to heat and destroy cancer cells inside the prostate. Think of it as using a magnifying glass to focus sunlight onto a small spot. The ultrasound energy raises the temperature of the cancerous tissue, causing it to break down and die. Because there's no incision, HIFU is typically performed on an outpatient basis, with most patients going home the same day. The procedure lasts about 2 to 3 hours and is usually done under spinal or general anesthesia. HIFU offers many benefits. It reduces the risk of incontinence and erectile dysfunction, shortens recovery time, and can be repeated if necessary. However, it's best suited for patients with small to medium-sized, localized tumors. Another exciting option is irreversible electroporation, or IRE. This innovative technique uses very short, intense electrical pulses to create tiny holes in the membranes of cancer cells, disrupting their integrity and causing them to die, while leaving the surrounding nerves, blood vessels, and connective tissue unharmed. Unlike heat-based therapies like HIFU, IRE is a non-thermal ablation method. This makes it especially useful for tumors located near critical structures where preserving nerve function is essential. IRE is usually performed under general anesthesia and requires specialized equipment and expertise. Although it's newer than HIFU and not yet widely available everywhere, clinical studies show promising results in cancer control with fewer side effects. So how do these treatments stack up against each other? Let's compare their effectiveness, side effects, and ideal candidates. Surgery remains a highly effective treatment for prostate cancer, but carries the highest risk of long-term side effects like urinary incontinence and erectile dysfunction. Recovery can take months, and patients often need additional therapies. HIFU is less invasive, with lower risks of incontinence and sexual side effects. It's great for men with small to medium localized tumors who want to avoid surgery but still want effective cancer control. IRE is newer and more specialized. It offers precise tumor targeting with minimal damage to surrounding nerves, making it ideal for tumors close to sensitive areas. However, it's less available and still being studied in larger patient populations. Ultimately, the choice depends on your cancer size, location, aggressiveness, and personal priorities regarding quality of life. These advanced focal therapies are typically best for men with localized prostate cancer that hasn't spread beyond the gland. Good candidates often have PSA levels under 10, Gleason scores between 6 and 7, low to intermediate risk, tumors visible on MRI scans, no evidence of cancer spread outside the prostate. Your urologist will evaluate your overall health, tumor characteristics, and personal preferences before recommending the best treatment plan. It's important to have open conversations and consider options beyond surgery if preserving quality of life is a priority. Thanks for watching this deep dive into the latest in prostate cancer treatments. If you found this video helpful, please like and subscribe to Urologist USA Today for more expert insights into men's health and urology. Have questions? Drop them in the comments below. I'm here to help. Remember, early detection and informed decisions can make all the difference. Stay proactive about your health and see a trusted urologist to discuss your options.